Assalamu alaikum, dear viewers. Once again, welcome to my new lecture. In this lecture, I will discuss about the classification of drugs used in the treatment of migraines. So, if you remember, in my previous lectures, I have already discussed about the whole clinical pharmacology of migraine along with nursing interventions and the pharmacokinetic and pharmacodynamic profile of all these agents. But today I am going to highlight just the classification of anti-migraine drugs. So drugs for migraine that is being classified into two categories. The first one is to treat attack, while the second one is to treat attacks. So it is been divided into three groups. The first one is simple analgesics, then antiemetics, and then selective 5-hydroxytryptamine agonist. Simple analgesic include paracetamol, aspirins, metamezoles, and codeines, while the antiemetics includes metoclopramides, domepiridones, and prochlorperazines and promethazines. Actually, all these drugs, they are used to treat the attacks whenever after attack of migraines. So it has been suggested to the patients that you can use these drugs like simple analgesic antiemetics. Selective 5-hydroxytryptamine agonist, that is sumatriptans, rizatriptans, naratriptans, and zolmitriptans, and froatriptan. While the drugs used for the migraine, especially how to prevent the attack, so these are the agents which are used in the treatment of migraine, that is propranolols. So as we know that propranolols, this is other beta blockers, that is also antihypertensive agents, amitriptyline, which is antidepressant. So this drug is also used to prevent the attack of migraines and other TCA tricyclic antidepressant. Flunarizine, valproic acid, gabapentin, topiramate, and cyproheptadines. Okay, now come toward the other agents, that is NSAIDs and Ergot alkaloids. So NSAID include ibuprofen, naproxenes, and diclofenacs, while mefenamic acids, so Ergot alkaloids include ergotamine and dihydroergotamine, that is represented by DHE. So this is a very simple and easy classification of migraine, so you can memorize all these things by your fingertips. Okay, now let's come toward the preparation and different doses related to migraines. Okay, so the first one is ergotamines. As we know that, so ergotamines that is available in the dose of 1 milligram oral sublingual. Repeat is required, but the maximum dose is 6 milligram. That is 0.25 to 0.5 milligram subcutaneous or IMs. Ergotamine is available in 1 milligram tablet and 0.5 milligram per ml injections. Migraine. So actually you can see these red lines. These are actually the brands which are available in the market, and you can purchase this drug by different trade names by different manufacturers company. So that is ergotamine, 2 milligram, caffeine 100 milligram, cyclizine 50 milligram tablet. Vasogran, this is another agent. You can see ergotamine, 1 milligram, caffeine 100 milligram, paracetamol 250 mg, and then prochlorperazine, that is 2.5 milligram tablet. The second one is dihydroergotamine. So dihydroergotamine is also available at a dose of 2 to 6 milligram oral. Its maximum dose is 10 milligram per day. So this should be memorized. that the maximum dose for dihydroergotamine is 10 milligram, while for ergotamine that is 6 milligram. So there is 4 milligram difference, 0.5 to 1 milligram IM and subcutaneous. It means that this drug can be injected in the form of injection. So dihydroxy, you can say dihydroergotamine, that is in 1 milligram tablet, migrainils, 1 milligram per ml injections. Another agent that is called somatriptans or zolmitriptan. So somatriptan at the dose of 6 milligrams subcutaneously, 50 to 100 milligram oral at the onset of migraine attack, and may be repeated once within 24 hours if required. So those not responding to the first dose shouldn't be given the second dose, because 25 milligram in the form of nasal spray and may be repeated once after 2 hours. So these are the different brands like Somanets and Somatrex, which is also available in 20 in different doses like 25, 50, 100 milligram tablets, Magneton, so that is 50 milligram and 100 milligram tablets, and Somatrex injections are KED 6 milligram and 0.5 ml injection, and also Somanets 25 milligram per actuations nasal spray. Another drug that is rizatriptan. So this is also used in the treatment of migraine. So that is available at a dose of 5 to 10 milligram at the onset of migraine attack, and may be repeated after 2 hours if required. These are not responding to the first dose, shouldn't be given the second dose. So the brands which are available in the market, that is Rizact and Rizatans 5 milligram, 10 milligram tablets, while the fifth one is flunarizine. So flunarizine is also available in 10 to 20 milligram OD, and children 5 milligram OD, and no migraine. So these are actually, you can see it, these are which I have already highlighted here, that these are the trade names, or you can say the market names, or proprietary names of the different agents like nomigraines and flonarines, so which is available in 5 milligram, 10 milligram capsule tablets. One important point should be noticed that for preparation of other drugs, so you can see the index. I have already explained each and everything. So this was all about the the classification of those drugs which are used in the treatment of migraine. So kindly review all these lectures. Then if you have any questions, or if you have any confusions regarding the doses and preparation, so then you can directly contact me through my email. Thank you so much for watching my lecture.